Hi, I'm Dr. Jerry Yu from Amos Sports Medicine. Today we're talking about a stretch that I frequently see not done correctly inside the gym, and that's the quad stretch. Now, stretching obviously is a very important part of fitness and it's often overlooked, but if you do it the wrong way, you can actually cause more damage or not even get the desired effect that you want from that stretch. So we're going to show the quad stretch, and the first thing I want to show is how most people end up doing this when I see them in the gym. This doesn't do anything, really. Maybe for some people who are extremely tight, it might be a way to sort of start stretching out the muscle, but if you really want to get the muscle to be fully stretched out, what you want to do, and Peter's demonstrating right now, is pull that leg back a bit, and you'll really feel the pull from across the knee up to the top of the hip. And that's the way that you want to do this correctly in standing. Obviously, if your balance is poor, holding on to a surface or sturdy surface will be helpful for you as well. And I typically have patients hold that for about 30 seconds to even a minute, but the key with stretching is really doing it throughout the day. So doing it one time is really not going to be beneficial. You might as well not stretch. But if you're going to do that to get some sort of effect from it, what you want to make sure you do is do that all throughout the day. So I'll typically have patients go for, say, 3 to 4 sets of 30 seconds to a minute, but have them do it maybe 4 or 5 sets in a given day. And that, over time, will have the most benefit for that patient. Again, if you have any pain while you stretch, you always want to be sure to let your physical therapist know, your personal trainer, or even your physician know that that stretch is not helping you, but it's actually hurting you. Another stretch that I see that's done incorrectly is the hip flexor stretch. Now, there are 2 ways that you can do this correctly, but we'll first demonstrate how people do it incorrectly. Okay, this is a common way that people do it incorrectly, and that can actually end up causing you some pain in the back. It can also cause some pain in the pelvis, which is undesired, obviously. The way you should be doing is first almost tucking your belly in and keeping your spine and your pelvis in a neutral position, and then letting your front knee take you forward, just like so. And what you'll feel is a stretch right above the hip in this area here. And for most of us who have tight hip flexors, this is a very good stretch to do. Dancers in particular, people do a lot of hip flexion type activities, cyclists, runners, and such. This is an important muscle to address. It's an important thing also with the hip flexor in particular not to overstretch it, because that can also be detrimental to performance.